Meantime, mounting pressure for Health and Human Services Secretary Kathleen Sebelius to step down following the troubled healthcare exchange rollout. Even former White House Press Secretary Robert Gibbs saying, quote, "When they get it fixed, I hope they fire some people who were in charge of making sure this thing was supposed to work. We knew there were going to be some glitches, but these are glitches that go, quite frankly, way beyond the pale of what should be expected." And today, RNC Chair Reince Priebus said Secretary Sebelius should also be fired. Republican Congressman John Fleming of Louisiana says the same exact thing. And he joins me now. Hi, Congressman.
Hi, Gretchen. Great to see you.
So why should she go?
Well, Gretchen, this law passed 3.5 years ago. Secretary Sebelius has had that length of time to roll out the rules and regulations. And, of course, that's been a terrible rollout, 30,000 pages of these very complex regulations. And then when they went out to seek contractors in order to implement this data platform, they missed a lot of delays. Then we find out through Ezra Klein of the Washington Post, they deliberately forced the information on the subsidy before actually finding out what the cost to the enrollee is going to be, and that's created many problems. So this thing is only the first stage of the rollout of the implementation of Obamacare. The rest of it is going to get a lot worse. It's actually going to go down from here, not up.
Many people were surprised that the Secretary went on The Daily Show with Jon Stewart. He grilled her. Here's part of it.
Started a little rockier than we'd like. It's better today than it was yesterday, and it will keep getting better.
Better today than it was yesterday, although wasn't it shut down, parts of it, for most of the weekend?
Yeah, it's up and down, and again, these news organizations are scouring the countryside trying to find someone who's actually fully enrolled in this program, and yet to find one, from all we can determine, we may find Bigfoot before we actually find an enrollee. and so as a result of that, and again, Gretchen, there's a lot more that needs to be done, and we've got a January 1st deadline coming up.
Yeah, well, let me ask you this. If the federal government can't manage a simple website, how in the heck can they manage millions of people coming under government health control, health care?
That is the question we've been asking for 4 years throughout this debate, Gretchen. Government is not good at managing these sort of things. It's not built for that. These are the sort of thing that private organizations do. But no one has ever taken on such an ambitious task to have multiple programs all interacting with one another and interfacing across the country, and having data hubs and having it fed to HHS and also to the IRS. And we find out from Mr. McAfee, an expert in this, that this thing is rife, ready for fraud, waste, and abuse and identity theft.
Right.
This is really a ship leaving the dock. It's a Titanic looking for an iceberg.
And we had John McAfee on this show just a couple of days ago, and you are correct. That is what he said. Congressman, thank you so much for your time today.
Great. Thank you, Gretchen.